I think, having a good attitude was just really part of my disposition. I never complained or whined or cried about anything, uh, especially getting hurt, stuff like that. It never really bothered us. We were always polite already, so getting along with the staff was really easy. And I think it really does help when you have a good relationship with the nursing staff and your doctors, and then even the cleaning crew at night, the ladies bringing the lunch. Everybody pretty much knew me up there after a while, and plus my mom was always with me, so it was actually pretty easy for them to come and check on me and stuff, and they could actually take a little break there if they wanted to, just kind of, because it's not always like that up there. I know it isn't, so it's very stressful. So I guess if they, came to my room, it was just a little break. We started a Facebook page, and it's really an ongoing thing because everybody who gets invited there is usually a new parent, with a kid up there, and it sort of details sort of what I went through and how I turned out now, and that, hair does grow back, and, really it doesn't have to be a bad experience, and you have to really help yourself, really, being able to come to terms, accepting what you're having to go do and the treatments and stuff, because it's all for your own good, you know. There's a lot of things I would like to begin doing again, but I might be able to do a little bit later down the road. A lot of things I miss, like soccer and just going out and doing sports, running and jumping and doing all that stuff. And I've had to make a few life changes, especially concerning work, because I might have actually been responsible for a few of my relapses, trying to go to college and stuff like that, but I was never really good at college, and I had a lot of anxiety every time I would go. It's kind of demanding, and I wasn't really the school type. So getting a job, I've always had to take a job that was maybe not necessarily what I want to be doing, but something I can do and I can keep up with. And whatever job I am doing at the time, I try to build myself up with it, so expand whatever things I might be doing later on down the road. Right now I'm in a receiving at a retail store. I do a lot of heavy lifting, a lot of pushing, and it's sort of substituted for my physical therapy, which I would like to do a lot more of, but work is pretty demanding, and so I try to make do with what I have. I wear orthotics, and I had a lot of because I would go into atrophy, like not like real total atrophy, except maybe once or twice, but just the amount of laying down I tended to do because of how bad the medicines would make me feel. And if I could do anything differently, I would definitely become more active, because that saying, use it or lose it, is really true when it comes to your body. If you don't get up and take the stairs or walk around the hospital a bit. But yeah, it's that I'd kept up with that, I'd probably be doing a lot more things than I'm doing now. To really be a survivor, you got to get back to what you were doing before. It doesn't run your life. You can make time to have to deal with that stuff, but really just think less about it, more about what you want to do. Think about where you need to get started, like where you're going to get, like the time that you spent doing this, start building a plan to, expand your horizon, because obviously, it didn't kill you. So go do and, treat yourself a little bit first, but then start making some plans, I wasn't, I was pretty much starting out of the gate when I was diagnosed. So I kind of really didn't get to start, I guess getting like a really good education, I was going to join the Army, but that never happened. So I had to make a lot of different changes to what I was going to do. Always keep a positive attitude, and for a lot of people, it might seem like this is it, this is what we've all dreaded, but it's not a for sure thing really all the time. See, leukemia was pretty bad, but keeping a level head and not worrying and just really being nice to others would help them be nice to you. It makes it a lot easier. I guess the more the staff is comfortable with you, the better they are at giving you your treatment. Trust your doctors. They know what they're doing. They've always known what they're doing. That's why they're there. That's why they are in the hospitals, because they met the challenges that it took that it required to be where they are, and they're professionals. And the nurses, they're professionals too. And just trust them. Trust them. Don't worry. Be happy. Just be grateful.